Hello everyone and welcome to the first video of my channel. My name is Katya and this is Freud and Beyond. This space is for anyone who is interested in psychology or are already practitioners in this field or even related fields, because over here we will be having discussions about articles, about books, about major psychologists and their theories. This is what I aim to do here. So for the first video I thought of starting with Harold Searles' really important paper, The Dedicated Physician. I think it's very appropriate for the time right now because as well as there being a spread of mental health awareness, there's also this new crop of therapists coming up, and especially early career therapists. What I've noticed is that a lot of us do face this feeling, this pressure of having to perform really well, and this is something which is also very relevant for other fields like doctors, nurses. This pressure to perform quite well can actually end up being a hindrance to the practice, even though it is a very natural and common occurrence. What I have prominently seen all of them dealing with is this problem of either having an imposter syndrome or having this pressure on themselves to perform really well, actually cure their patients in what they think is 5 to 6 sessions, which is not possible. So Harold Searles was a psychoanalyst who worked primarily with schizophrenic patients, and he was also one of the pioneers of psychiatric medicine. So his work, The Dedicated Physician, in the area of psychotherapy focuses on this gap which is present in our self-image as being these really caring professionals and the true feelings that we might be having towards the client. So these are intense feelings, and they can be contempt, rage, intolerance, or even impatience. But a word of caution over here: to interpret Searles as justifying abuse in the healthcare sector is to not understand him at all. What he is referring to is the fact that both the therapist and the patient are humans, and that this image of being a dedicated physician can not only be false but also a hindrance to the therapeutic process. But to actually understand what this idea of being a dedicated physician means, what Searles is actually referring to, we will break it down now. First, it's vital to understand what does change and what does help mean for the patient. Change, especially for the better, can be an intolerable state. What one needs to understand and also respect is the fact that the patient has come to their current position through a lot of trials and errors by trying numerous methods which can help them stabilize to that point. So to start analyzing all of this can mean a lot of discomfort for them, and it can also harbor this feeling in them that they will lose their sense of self. That is why we can sense a sort of ambivalence in the patient towards any change or any progress, and it can also be observed in the form of resistance in the therapeutic space. So entering into this picture, we have this dedicated physician who is there to help, yes, no denying that, but it also creates this image of help being unidirectional in the patient's mind. That is, it goes only from the therapist to the patient. So what comprises this feeling of being dedicated for the therapist? The way of relating to the patient absolutely changes the moment the therapist decides to fit them into these roles. So what they do unconsciously is maintain the immature ego functioning of the patient so that they remain in this helpless state itself. Pressure to be dedicated can also speak of an unconscious denial. This is the denial of the strength of the patient to go and seek help. Ignoring this also reaffirms the fact to the patient that they are someone who are not capable of giving anything or producing anything fruitful. So we all know that therapists are taught to affirm the fact that the patient has reached out to help. But Searles' work is a caution against not feeling genuinely so, because it is bound to come up in your work now or later. Lastly, this feeling to be dedicated can also come from this pressure to cure the patient. But what happens is that this pressure does not solely remain to the therapist, and rather it is carried forward onto the patient. And as explained, not only does this downplay their strength to come out and seek help, but it also downplays their existence as an individual who is more than their symptoms or more than their trouble. So Searle reminds us that it is not harmful to have the patient being meaningful to you. But what is problematic is adopting this dedicated physician role and not acknowledging the feelings that you are having for the patient honestly. Searle further gives a psychodynamic explanation for why it is that we do adopt a dedicated physician image. He states that the therapist holds at an unconscious level split images of themselves and their patients. One is an idealized image and the other is a diabolical one. What the therapist expresses here is his own feelings of hatredness and subjectively non-human feelings are then projected onto the patient, while the therapist is simultaneously demanding to become healthy so that they can keep up his own idealized self-image as a savior. This is what creates the gap between the therapist and the patient. So a word for the therapist from this article is that therapists should acknowledge the feelings that they are having, no matter how harsh it seems. And a really important point which he picks up is the need for humor and play in the therapeutic space itself. Humor and play allows the patient to also be themselves, to be able to actually open up, and for both of them to be able to maintain the therapeutic alliance. So a note to all the early career therapists out there, Searle understands the pressure that can come out. So thank you so much for watching the first video. If you liked it, please give a thumbs up. If you have something that you want to discuss, you can start a discussion in the comment section itself. And I will be coming up with more videos and really hope to see all of you over there. Bye.